Good afternoon, doctors. My topic is the spinal cord. The spinal cord is a long, thin, tubular bundle of nervous tissue and support cells that extends from the brain, the medulla specifically. The brain and spinal cord together make up the central nervous system. Signal for brain to body. And signal from body to brain. The spinal cord begins at the occipital bone and extends down to the space between the first and second lumbar vertebrae. It does not extend the entire length of the vertebral column. It is around 45 centimeters in men and around 43 centimeters long in women. Also, the spinal cord has a varying width ranging from a half-inch thick in the cervical and lumbar regions and 1/4 inch thick in the thoracic area. The spinal cord is supplied with blood by 3 arteries that run along its length starting in the brain, and many arteries that approach it through the sides of the spinal column. The 3 longitudinal arteries are called the anterior spinal artery and the right and left posterior spinal arteries. Somatosensory organization is divided into the dorsal column medial lemniscus tract and the anterolateral systems, or ALS. Both sensory pathways use 3 different neurons to get information from sensory receptors at the periphery to the cerebral cortex. A graphic that shows the different segments of the spinal cord. Spinal cord injuries can be caused by trauma to the spinal column. The vertebral bones or intervertebral disc can shatter, causing the spinal cord to be punctured by a sharp fragment of bone. Usually, victims of spinal cord injuries will suffer loss of feeling in certain parts of their body. Damage to upper motor neuron axis in the spinal cord results in a characteristic pattern of ipsilateral deficits. These include hyperreflexia, hypertonia, and muscle weakness. Lower motor neuronal damage results in its own characteristic pattern of deficits. Rather than an entire side of the deficits, there is a pattern relating to the myotome affected by the damage. Additionally, lower motor neurons are characterized by muscle weakness, hypotonia, hyperreflexia, and muscle atrophy. Pros: there are many advantages to the spinal cord or peripheral nerve field stimulation for the treatment of chronic back pain. A trial can test patient response before the patient commits to a permanent implant. It has few side effects and is easily reversible. If it doesn't work or is no longer needed, it can be removed. Implantation of the system is minimally invasive, requiring a relatively minor surgical procedure on an outpatient basis. Cons: spinal cord stimulation interaction with therapy, pacemakers, MRI, and therapeutic ultrasound can result in unexpected change in stimulation, serious patient injury, or death. It can also lead to failure of the device. Medtronic is the only company with the technology in spinal cord stimulation that is safe for patients to undergo an MRI. However, the Medtronic equipment is sometimes combined with other brands of equipment and can therefore still make MRI unsafe. In Ecuador, paraplegic man died following stem cell operation in a young paraplegic man desperate to find a cure died following a controversial stem cell operation in Ecuador. And inquest heard Ricky Chick, 27, of Silverwood Close, Croydon, was left paralyzed from the waist down after a serious motorbike accident in 2004 and became frustrated at the options available to him in England. He decided to travel to Hospital San Francisco in Guayaquil, Ecuador, for private treatment using stem cell technology, which is being trialed in some countries for treatment of spinal injuries among other conditions. During the operation in August 2009, in the South American hospital, stem cells were placed into his spine. But when Mr. Chick came around, he could not stand a noise and wanted to remain in darkness. Creighton Corners cured her. Thank you.